Today I'm going to be interviewing Minda Wesley. Hi, Minda.
Hi, Allie. How are you?
I'm good. How are you?
Not too bad.
So, at the end of the summer, you started having some trouble with double vision and the hearing in your right ear. Can you tell me about that?
Yep. I was teaching in California for the summer, and when I flew back home, I started experiencing double vision. And as it lasted for about 4 days or so, I called my eye doctor, to see if there was something he could do.
And when you went into your eye doctor, what did he say?
Well, first I called him to see if maybe he had eye drops, thinking that there was a quick fix for double vision, but that did not exactly happen. So he asked me if I could, I asked if I should schedule an appointment, and he said that I should probably come in right away. So I went in, and I spent about 2 hours in his office where he did a variety of tests, and he diagnosed my condition as sixth nerve palsy, which is what I had, the double vision, but he didn't know what was causing it. So that's as far as he could go.
After that, what happened? Did he do anything to help you out? Did he just kind of leave you on your own?
He then sent me to an ear, nose, and throat specialist who was able to do a hearing test, and my right eye was the one that was affected by the sixth nerve palsy, and it was my right ear. I had some hearing loss in the high and low frequencies. So he recommended that I go in and get an MRI because based on the hearing loss, since it was on the same side as the eye, he said, there's something causing the hearing loss. So he wanted a picture of my brain to figure out what was causing the hearing loss.
So you went in for an MRI. How was that?
That was a little nerve-wracking because I, of course, as soon as I got home, went on the internet, and there's all sorts of stuff you don't want to find on the internet. So I had a feeling that there was something, a mass, something growing inside my head, or an infection. The eye doctor had also mentioned that there could be an infection in there. So those aren't words you really want to hear from a doctor. So then we had to wait a little bit till we got the MRI results and got back into the specialist. So.
And when you went back to the specialist, what did he have to say about your MRI results?
The specialist actually was just there for the diagnosis, and he was able to say, yes, you have a brain tumor, so he was able to make that diagnosis, but that's pretty much as far as he could go. It was rather large. It was about 4 centimeters, so about the size of a walnut, a large walnut, so I had a feeling that it was something that was not just going to be watched or treated with radiotherapy, but, I wanted to meet with a surgeon to see.
So, your next step was meeting with the surgeon. How did you go about doing that?
I actually have an uncle who is a plastic surgeon. He actually went to West Point with this doctor, Dr. Maurer, Dr. Paul Maurer from Rochester. So when I called my uncle, who's the smartest man I know, and said I need some medical advice, he said, you need to get the best surgeon possible, and that will be Dr. Paul Maurer in Rochester, which is nice since that's where I'm from. So he was actually helpful scheduling me with an appointment here in Rochester, since everything I had done at that point was in Columbus.
So you decided to go with Dr. Maurer, and what did he say you needed to do?
So it was actually the week of Labor Day that I came in. I had my meetings with the surgeons, and so I was back here in Rochester, and I had planned on, hoping that I could schedule end of September, early October for my surgery so I could go back since I was still teaching at the time and kind of get everything in order and things like that. But after I met with a surgeon, he said that it was large enough and it was pushing my brain stem, and based on the location and the size, that he wanted to take it out the following Tuesday. So I stayed at home and had the surgery.
And so the surgery went smoothly?
Yep. It was a couple hours long. I was out. It seemed like 5 minutes for me, but I think my family probably thought it seemed like 3 days. I think it was actually about 4 hours, 5 hours. I don't even know.
Okay.
Actually, something like that.
So when you came out, how did your recovery go?
Not too bad. I was in the hospital for 4 days, and after that I came home and just kind of stayed in my bed for a while. It went well. Staples were in for about 10 days. They took the staples out, and there are still lots of stitches that I feel those come out every once in a while.
Well, that's great. Thank you so much.
You're welcome.